Hello, welcome to the Professor Carol Doyle Simulation Centre.
If you'd like to follow us, we'll show you around our amazing simulation centre.
There are 2 ward spaces here, set up as you'd find them in the hospital with equipment.
So we can treat people across the lifespan from paediatrics through to adulthood. We have a range of high fidelity mannequins with lifelike actions. They blink and breathe. This allows us to practice patient assessment and better understanding of vital signs.
This is our brand new digital simulation space with 1-bedroom home suites with full telehealth facilities.
In this space, we're able to simulate care in the home environment, and using the technology installed, we're able to stream this to larger groups of learners. Welcome to our anaesthetic room. This is the start of the patient's surgical journey. We have the facilities to follow a patient's entire surgical journey,
from pre-operative anaesthetics to surgery and post-operative recovery.
Our use of new digital technologies means that we can learn anatomy and physiology from the whole organ down to a cellular level. This is our telehealth suite, which we can have small group teachings where we might simulate MDT meetings with some small booths around the side.
For individual use and remote care delivery. This is our basic life support area where we practice our basic life support skills on mannequins. It is essential to have prior to going out on placement. This is our high dependency complex care area where we can further assess a deteriorating patient.
Here we can work on our communication and team working, developing our interpersonal skills using SBAR, handover and escalation techniques.
This is our birthing centre, which is set up for high and low risk mums. This is the couch where we are able to support the birthing mother in different positions. We have our birthing pool where we are able to further assist during delivery. We have our resuscitators if babies required extra support. This is a high fidelity mannequin that allows us to carry out abdominal palpations, observations and the VR to monitor babies' well-being.